Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
We are pleased to welcome Lennie Walser, a pharmacist and owner of the Medicine Shop Pharmacy in Nova Scotia, Canada. Thank you for joining us on Redefining Medicine. So you own the Medicine Shop Pharmacy. Can you tell us a little bit about that pharmacy?
I'm in a town called Truro, Nova Scotia, so about an hour outside of Halifax, our kind of only famous city in the east coast of Canada. And I own two Medicine Shop pharmacies. They are franchises, independently owned. Technically, my wife is now a pharmacist working for me as well, but I started them up by myself. She's a pharmacist as well. And one of them is just a traditional contemporary regular medicine dispensing. The other one is a compounding PCCA licensed pharmacy.
Right. So which one did you open first, the conventional one?
I actually started the conventional one and I had compounding in it. It was a very, very small footprint. These are medicine shops are really like 1,000 to 2,000 square feet. We're just healthcare. These aren't, I guess, for the Americans, CVS or type stores with chips and powders and pop. This is just health related products, which is why I got into pharmacy. And I started with a very, very small compounding lab, barely the size of a closet or slightly larger. And we outgrew it, and I couldn't find a place to move, and I didn't want to destroy my practice where I was currently at. So I opened a second location, moved the compounding lab there, and we're in about 2,000 square feet in the new area, and we got about 800 square foot compounding lab doing non-sterile products.
What sparked your interest in compounding?
Well, to be honest, it was a business decision. I was a pharmacist, both community, and I was actually ICU, CCU at the hospital. Whatever reason, hospital politics in Canada kind of took a little life out of me, and the opportunity to potentially come on and work at this independent pharmacy in my area, open a franchise happened, and I did it, but I also knew strategically I had to offer something different. And I'll be quite frank, I did not know much about HRT. But I was aware of some women who were friends of ours that were using it. And when I heard how much money they were spending on it, I was like, I better look into this. Went to a conference in Vancouver, an HRT symposium. I believe Dr. Pam Smith was one of the speakers that weekend. A PCCA friend and now colleague, Sebastian Dennison. Actually, that is where I learned about A4M. He's like, basically saying that weekend symposium was just a small taste of where this could go, encouraged me to go to a module and do the actual fellowship program. And that was probably 6-7 years ago, I think. And that's how I kind of got to where I am now. So you're a fellow and you're board certified. Correct. In the US, but Canada does not recognize my distinction.
Right. But the knowledge still remains.
The knowledge is actually why I really did all this. I look at my role in the patient-physician relationship as not just drug dispensing, but I want to offer all the therapeutic options for the patient and physician and be truly evidence-based, not just pharma grade, but I want to know diet, nutrition, I want to know if there's botanicals or nutraceuticals that can not only help the patient acutely, but reduce the risk of chronic disease. So that is what A4M kind of opened me up to, is just there's a whole lot more that I as a pharmacist can offer.
Right. And I know that they refer to that as the triad, the pharmacist, doctor, patient relationship. Yeah. And it can be tricky because sometimes if you're working with a physician who is conventionally trained, allopathic as it were,
yes,
and you've got perhaps an alternate approach. How do you handle some of that?
Fortunately, I'm in a very small town, and in my small town, I did work with majority of the GPs and physicians I deal with. I did get a little respect and rapport in my general medicine, CCU, ICU regimen, work career. And so they knew me personally. They knew I was not radical. I am an evidence-based person. And what A4M and PCCA were really great. Like, I'm busy. I own a business or two. Like I said, I can't do all the research. So when I do a module, I'm getting practical experience, but I'm also getting references. So when they really doubt me, I was like, listen, here's some references. By the way, this physician in this area, this was their anecdotal story and their experience. We looked at the pros and cons, the patient's comfortable paying for the nutrient, perhaps. The risk is really minimal. It's worth a try. And that's kind of basically that. It's really the same as pharmaceuticals. It's just I have a little bit of a bigger repertoire of options than the conventional pharmacist. Any compounding pharmacist, that's what they do anyway. I just have a little bit more compounding experience, but now I also have a little bit of the nutraceuticals, botanicals, and a little bit more understanding why they work. And I think that's all most physicians want is there evidence? Is it safe? And if so, it's worth a try and see how the patient responds.
Sure. So that's how you work with the physician, is, showing him evidence-based research.
100%.
How about with the patient? Because I know a lot of times a patient will come to a physician with a symptom, and they really want to walk out of there with a script, and they want to go to a pharmacist, and they want you to fill that, and they want to take that drug and just kind of be on their way. How do you consult then with the patient? Same way.
Well, sometimes that is just what happens. They're going to have some patients that just I want my blood pressure medication. Don't counsel me on diet and salt and exercise. They don't care. But you're going to have some patients that I don't want to be on this medication. What else can I do? Or you're going to have some patients that I'm on my medications, I'm on 2 or 3, and they still don't work. What else can I do? So a lot of times during the counseling, be it, I was like, do you realize if you lose 5 to 10 pounds, you may not need this medication, or so-and-so, be it diabetes or whatever. And that kind of spills from it. And honestly, it's just like any physician, maybe not so much for physicians, maybe I'm speaking out of turn, but for pharmacists, it's developing a relationship with the patient. Eventually, as you keep giving them advice over the years, they get to know you, the trust level goes up. So for a new graduate pharmacist, it takes time to get to know those patients and develop that trust. But for people that have had their practice in their area for multiple years, and most pharmacists, if they're listening to this, will know what I mean, they trust you. And usually when you recommend something, they're going to at least try it. But that's it. It's not that difficult. The main thing is just you have to be confident in yourself and your knowledge, and have that backup. If I'm just throwing out magnesium glycinate for the sake of throwing out magnesium glycinate with no evidence or suggestion, or even at the bare minimum, understanding the mechanism why it could help a patient with some chronic pain issues, that's reckless. But if I can at least say, hey, there's some data, this is theoretically why it works, let's try it and see how it responds. That's what the art of medicine, pharmacy is all about.
Right. Are you finding that the general public has a more of an appetite for integrative, anti-aging, functional medicine? Are they growing? Yeah, definitely
growing. Sorry to interrupt, but yes, 100%. I will articulate that probably Canadian medicine and integrative functional is probably 5 to 10 years behind the United States, to be honest. But there's pockets. It's growing. The internet can be a very powerful weapon in this world. And that's actually the really interesting thing I've discovered. A lot of the products I sell, they're professional grade. They are available on Amazon, things like that. But at least in my community, they still want my input and feedback. And usually they still buy from me. Like, they're not trying to cut out that 10% savings or whatever. So it's worked out quite well. I've gained prescription customers over the years because I've helped somebody start a supplement, just word of mouth. So.
Right. Yeah. I mean, it's confusing to know, how much to take and what to take. And then is it is it good quality, and you have to do a lot of research. I could see why somebody who, you've built that trust with would just kind of go with your recommendation and buy it from you. It's easier.
Oh, it's quite funny. Even internally in my home, my wife is a pharmacist. She will tell you she does not know any of the botanical nutraceutical information, doesn't understand it. She trusts me. She's starting to repeat a lot of the things and recommendations that I give, but she will tell you she doesn't fully understand it. I think she's about to start coming to some A4M events with me. I think she's starting to get interested. She's seeing how patients are responding to certain therapies, and it grows on you. But you said conventional medicine, conventional pharmacy, we're not open to these therapies, and it's a shame.
Yeah. Back to BHRT, with the physicians that you work with, what percentage would you just guesstimate are still prescribing synthetic versus physicians who are prescribing BHRT?
I would say the general physician, when they prescribe it, is usually synthetic still, 95% of it. Mm-hmm. The bioidentical compounded versions, I would say it's mostly patients doing their own self-education, begging their doctor or searching out a functional medicine doctor in Atlantic Canada, which is actually far and few in between, and advocating themselves. A lot of time it is myself. They'll contact me. It's like, my physician is open to it, doesn't know how to do it. Can you give me the recommendation, and so forth. So I am able to provide saliva testing for bioidentical HRT, explain to the physician how to dose it, and have the patient counseled, and also do the follow-up. So usually once that happens, it works quite well. The difficult challenge is Canadians are not used to paying for therapy. It's usually not covered by insurance plans, and they're also not used to paying for testing, which is saliva-based, obviously, and is not covered in Canada. So once you get past the doctor and you have self-advocate, they have to accept that there is going to be a monetary charge. But usually, my experience, usually 3 to 6 months to a year, the patient's starting to respond quite well and is much happier.
Yeah. They see it as an investment in their health. And the same issue is with physicians who have transitioned their practice to a concierge type, cash-based practice. Yeah, that's a difficult thing for somebody who's perhaps had insurance their whole life through a job or whatever, to all of a sudden realize that if they want these quote unquote alternative therapies, they're going to have.
We all love that term.
Yes.
but it is shameful. Like, I've learned over the years, like, I'm a very keep it simple, stupid type of guy, and I pick any module or seminar. I'm always looking for that 1 or 2 key points that I can implement. And one of the biggest things I learned over the years, never would have before A4M, like, I'm a big fan of L-theanine and magnesium. I have helped so many people with L-theanine, with anxiety disorders that came off SSRIs, traditional antidepressants, and I never would have known of that product if I didn't do any of these courses and research. And it's amazing. Like, it's not even that expensive, very safe, quite effective. That's just one example. But
do you work with CBD at all?
I love CBD. In Canada, I love THC. A4M is actually one of the formats that I think they're one-day modules or events. Dr. Maroon, a lot of great experts that promoted and gave a lot of evidence for cannabis, gave me my confidence even more so. I was already involved with it anyway, but to have that option of references and to hear every practitioner's stories that were there, it just keeps building and building. So yeah, CBD is big. I say in Canada, get the privy of using a lot of THC as well. They both work, and you just need to know how to do it. Try your CBD for a month. It's not a miracle. It can be a very effective therapy. And if you're not finding the benefits, stop it. But guess what? If you find everything returns or gets worse after you stop it, there was an effect. There's really not a big titration with CBD. THC, it's a little trickier you just can't stop and go, but CBD is excellent. It's such a wonderful thing to try, and it does work quite effectively.
Yeah. I think just the consumer needs to be aware that CBD is all not the same, or not all the same. And I've seen it
full spectrum. Yeah. Isolate.
I've seen people selling it roadside, just their car pulled over and a little easy up a tent and a sign that says CBD, and so I think it's important that people understand that it's not, that there's a process, right, in getting the oil and the quality of the plant that it comes from, and that it's not mixed with other stuff, cut as it were, right?
Yep. No, 100%. That is kind of the one nice thing in Canada. Like, to be on a shelf, you are forced to actually do C of A testing. I'm not sure about the United States, the regimens. I heard there has been issues of not fully quality CBDs, like you said, roadside stands and things like that. But that is the one advantage we do have in Canada, that everything does require testing. But again, there's a bit of an art to it as well. How much, I'm not a fan of the isolate. 0 THC doesn't quite work as well. You can use it, but I do find you almost need 3 to 10 times the dosing in some people to get that same effect. But even understanding, is it a winterized crude extract? Is it been decarboxylated? Is it distillate, isolate, carrier oil? Like, I'm a big fan of using or seeing products, and there's very few in the world. I've actually only seen them in the black market. Is hemp seed oil is the carrier, and it does work a little bit better. But I've had some interesting things. MCT oil. I've seen a couple of patients get intense diarrhea with just little 0.5 and 1 ml doses of CBD oil and MCT. So I'm actually now more for a grapeseed oil or an olive oil base is what I switched my tune to as well, just because I've had that 1 or 2 patients get intense diarrhea from the MCT. So everyone's CBD is interchangeable. It's not. It's just like, I don't switch one thyroid brand to another thyroid brand just thinking they're automatically the same thing. It doesn't work that way.
Well, you know what? Thank you so much for joining us today. It's been nice getting to know you, and hopefully at one of the upcoming conferences, once the COVID thing lifts, we'll have a chance to meet.
Well, fortunately, A4M has excellent video modules that I've done a lot over the years, because one of the hard, it's not always easy for me to get to travel out of Nova Scotia even before COVID. It's usually 2 or 3 connections. And I don't think I'm actually allowed in the United States for a while, so this may be my only forum for the next 6 to 12 months, to be quite frank.
Yeah, right. Well, again, thank you for joining us today. We definitely appreciate it.
No, this was fun. Thank you.